Thanks for coming in today.
Richard Steffi, who's 68, is a healthy, active senior. But like many people his age, he's noticed lately that he's having trouble remembering things, like people's names.
But it's catching a face that I know very well and saying, oh, Joe, Joe, Joe. That's the biggest hit.
Now, I know sometimes this is a little difficult to do, but all I want you to do is try your best, and this is what we're going to be having a look at. So,
he's taking part in a study being carried out by psychology professor Myra Fernandes. She wants to find out how people's brains work when they're using their memory. Why do we find it harder remembering names, numbers, and other information as we get older?
Well, there's really no simple answer except to say that it's part of the natural aging process. There are different connections in the brain that need to be maintained in order to carry out the memory task, and there's certain parts of the brain that we've been able to find out that show deterioration as you get older.
For this test, Dr. Fernandes flips through a series of pictures. The goal here is to remember as many of the images as possible. This test is then put away, but it will be pulled out later. Next, it's a test of connect the numbers. This measures aptitude and speed of processing information.
What I'd like you to do is to note that the numbers go from 1 to 2, 2 to 3, and 3 to 4. I'd like you to join the dots. I'd like you to do this task as quickly and as accurately as you can. Join the dots.
It seems fairly straightforward.
Go. Excellent. Well,
Richard is done in 3 seconds flat. Now it gets a little more challenging. There are numbers and letters to coordinate.
What I'd like you to do is join the dots, but alternate between numbers and letters. Numbers, letters. So, for example, you would go from 1 to A to B, 3, C, 4, D. You see how I've alternated between numbers and letters?
But even with the added information to process, Richard breezes through the task again in just 3 seconds.
Excellent. Well done.
So far, so good. Then Dr. Fernandes brings back that first test. It's been about 10 minutes since Richard saw the pictures, and he has to point to the ones he remembers.
What you to do is to say yes when I point to the item as to whether or not it was previously seen. We'll start at the beginning.
No. Yes.
Very good.
Oh, yes. 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 No.
Not bad. Richard gets most of the pictures right.
The way in which you perform this memory test is quite typical. You got quite a few right, though there are some errors. You overall performed quite well.
Assistant Tracy Francis on the left joins the group, and here's where it gets interesting. Dr. Fernandes wants to check Richard's skill in multitasking. Like when you have the radio on while doing homework. Can the brain cope with different information coming at you? Dr. Fernandes reads a list of random words, while Tracy calls out numbers. Richard has to tap the table at the odd numbers.
Rabbit, fountain, 1, landscape, 6, camping, 14, nephew, 23, lobster, 3, jewel, 7, army, landscape, 6, armor, 14, island, 23, lemon, 3, forest, 7, jewel, 12, army, 4, banner, 13, damsel, 5, kettle.
After that grueling exercise, Richard is asked to remember as many of the words as possible. Dr. Fernandes read 16.
Armor.
Yes.
But Richard can only recall one word.
That's it. I don't have a blessed other one.
Dr. Fernandes says using your memory becomes especially difficult if you're tackling more than 2 things at a time.
What our research has found is that it's the study phase that's most susceptible to interference. So if someone is trying to talk to you while you're listening to your doctor give you information about when to take pills, or your husband or wife telling you, don't forget to get milk at the grocery store, while you have a grandchild in the background trying to get your attention. These are situations where your memory is going to be hampered to a huge degree.
But here's an interesting discovery. When Dr. Fernandes gave the same test of multitasking to 20-year-olds, they didn't perform any better than the seniors.
This is the most detrimental to people's later memory performance. Both young and old adults show the same type of memory deficits, in that if you're trying to listen to the radio where there's some lyrics in the background, or someone's talking to you, or you're trying to do this other task while studying, memory will be drastically affected.
Besides the lab tests, Dr. Fernandes is also taking snapshots of people's brains while they think. These scans show an interesting picture. On the left, a 20-year-old taking a memory test, just a few blue dots. But on the right, the senior's brain shows big red splotches.
To maintain the same level of performance, the seniors have to work harder. There's more brain activation, in particular in the front part of the brain. They're really trying hard to find that information, whereas the young can recall it without activating the same number of brain regions to the same level.
The end result for Richard?
So overall, your memory might appear to be lower, and in fact it is. Memory decline does happen with advancing age. Your ability to multitask and cope with multiple things in your environment does not change, at least in terms of its effect on your memory performance.
And if you're having trouble remembering a name or a phone number, Dr. Fernandes suggests
the best way to deal with this is definitely to write the information down. It's your best solution. When you're going to the grocery store, you can have your list right there. You don't have to always rely on your memory if it's something that is not so critical as going to the grocery store and picking up some milk.